I've struggled with this my whole life. Just made me so insecure and life-changing. Thank you, Dr. Lebowitz.
This is Dr. Jonathan Lebowitz at the Long Island Gynecomastia Center, Long Island VaserLipo Center, and this morning it's a touch-up on this gentleman, so I stand by my results. He's got a great result as it is. We're going to show you the pre-op photos of him that we did, I think, almost a year ago, kind of, but he wants more done. So my technique always evolves. I always think about how to improve. You don't sit on your laurels, you improve every day, every case, every minute. Always improving, always thinking about new things to do. So in my old technique, a year ago or so, we did the incision here. So he's got a little scar here and a little scar right there. So I've transferred this scar to up here. And that way I can get from this approach with my probes, and I had specially made long probes, I can really get down to this. So I really sculpt the lateral part of his chest between the lateral aspect of the pectoralis major muscle and the anterior aspect of his lats to really scope this nicely. He's got no gland, these were removed, and if you zoom in here, the scar is absolutely inconspicuous whatsoever. On this side, he's lift up that, he's got a little bit more of scar tissue that I'm going to melt, and if I need to go back in there, turn the side a little bit, I will, but once I Vaser it, Power X Lipo Sculpt it, through the stealth incision over here, I can go in there and remove any glands or scar tissue that's under this nipple. This side I probably will not have to do that. I'm going to tighten the skin and sculpt him beautifully for results that are absolutely extraordinary. With my new improved techniques, curved cannulas, baby cannulas, the whole works. So in a minute I'm going to mark them, in a minute I'm going to numb them, in a minute we're going to go in the OR, and you're going to see firsthand of what I do. So now we're giving Novocaine. Remember, I stand by my work. So if somebody comes to me and says, I want a little bit better, I never argue with them. I'm never one of the ones that says, oh, you're good enough. So this is called tumescent fluid. It's the wet technique. It stops bleeding and allows me to use the Vaser because the Vaser is steam heat, ultrasonic steam heat, and that's how it melts the fat, melts the gland, and tightens the skin. So we're going into my stealth incisions right here, using the one ring. One ring is more like an arrow, cuts through the scar tissue under the nipple. So I'm going right across the chest with my smart hand again, as I said. Hug that rib cage. Curve cannula. Make straight lines into curves. Go right on over here. Get that nice hockey stick shape on this gentleman.